Hey, I'm Dr. Jeff Williams with Creekstone Integrated Care here in Amarillo, Texas. You know, we commonly see headaches in chiropractic offices, headaches and migraines of all origins, and some types are absolutely nothing new for a doctor of chiropractic. For some reason, the message doesn't seem to reach the general public just yet. However, in my experience, chiropractic is extremely effective for tension headaches, migraines, and cervicogenic headaches. It's my estimate that we are significantly effective for approximately 80% of these types of headaches. 10% or so, they don't necessarily go away, but they do get better. Then there's another 10% or so that we just can't seem to affect. I'd say those are pretty great odds. In fact, I'll share a couple of quick stories with you. When I first started in practice, even I wasn't really sure how effective we were for the headaches. My first year in practice, I had a patient come in who had had lifelong debilitating headaches. She had nuclear bone scans and injections to her suboccipital region. She'd never been to a chiropractor before. She decided to give it a try. And you know, I just did things that I was taught in school, kept my fingers crossed and hoped for the best. Well, the best happened. After about 2 weeks, she had no more headaches. Her enjoyment of life was back, and she was done being interrupted by these terrible headaches every single week. As many patients do, she fell out of treatment when she started to feel better, which is understandable. However, I ran into her about a year afterward and asked her if she had started having headaches again. She said that she hadn't, and that I had changed her entire life for the better. Now that's pretty powerful stuff right there, I tell you. That's why we do it. More recently, a really good friend of mine came to see me in the office. You know, I've known her for almost 20 years, but she'd never been to see me for chiropractic treatment. She shared with me that she had migraines 2 to 3 times a week. Now these weren't just migraines. They were so severe that lots of times she'd be laying in her bathroom floor and throwing up with the lights off 2 to 3 times a week. Can you imagine? So I started treating her, and very quickly her headaches just started to disappear completely. Finally, they just were gone. Again, you know, sometimes when pain disappears, patience disappear as well. She did great for 3 months without a headache. I recently saw her again, and they had started to return, but 3 months later, and one treatment got her back on track, and to my knowledge, she's back to normal again. Can you imagine how much her life has improved now that the burden of those migraines have been lifted off of her shoulders? Again, that's pretty powerful. Now remember, pain really can change a person, but so can the absence of pain. Now, let's get on with the research for this week, why they did it. Although there have been lots of studies that prove the impact of manual therapy and spinal mobilization for frequency and intensity of pain suffered from tension-type headaches, there have been no particular studies in regards to the effectiveness of the same therapies for the quality of life of the people suffering from them. The authors of this paper, they wish to discuss or they wish to focus on patient quality of life. Now, how they did it. The study was a randomized, single-blinded, controlled clinical trial. It was comprised of 62 women and 14 men. They were aged 65 years old all the way down to 18 years old. All subjects suffered from chronic tension-type headaches or episodic tension-type headaches. The subjects were categorized into 4 separate groups: suboccipital inhibitory pressure, suboccipital spinal manipulation, a combination of the two together, and then the 4th group was just a control group. A SF-12 questionnaire was used to help assess the subject's quality of life at both the beginning of treatment, the ending of treatment, as well as at a 1-month follow-up. And what they found, What they found was the suboccipital inhibition group improved significantly in their quality of life at the 1 month mark, as well as improvements in moderate physical activities. Not the control group, but all other treatment groups had an improvement in physical activities, pain, and social functioning at the 1 month mark. After treatment, as well as at that 1 month mark, the combined treatment category had improved vitality. And following treatment and at the 1 month mark, both groups that had spinal manipulation to the suboccipital region also showed improved mental health. Crazy. So let's wrap it up here. All 3 therapy approaches, they showed significant effectiveness toward improving the quality of life. However, the combined treatment therapy had the most dramatic change for the good. In short, manual therapy techniques and manipulation applied to the suboccipital region for 4 weeks or more showed great improvement and effectiveness for several aspects that measure the quality of life of a patient having suffered from tension-type headaches. I hope you enjoyed this week's blog. Subscribe to our YouTube channel, join us on Facebook, Twitter, Pinterest, LinkedIn, and Instagram as well. We're on all of them. Not to mention, be sure and visit our website at www.creekstonecare.com. Until next time, God bless.